Charlie Gard's parents are planning their son's funeral after his parents battled to bring the child to the U.S. for treatment. Gard would have turned 1 August 4th, but he died when his life support machine was switched off last Friday. Both of his parents, Connie and Chris, carried the gene that causes the incurable illness, which leads to muscle weakness and brain damage. It's a story that gained international attention. It's also impacted the medical world. And joining me now is Dr. Dennis Sullivan, director of the Cedarville University Center for Bioethics and professor of pharmacy practice. Thank you for joining us. Let's just start with some opening thoughts here. What is your thought process when you witness a story like this unfold?
Well, Brooke, what a difficult and perplexing case. We have an 11-month-old baby with something called mitochondrial DNA depletion syndrome, a disease certainly I had never heard of. Only a few children in the entire world have this disease, so there's no clinical experience with it. The doctors thought that the situation was hopeless. The parents disagreed, and that led to a huge international debate.
So we talked about the fact that both parents were carrying this gene. It's very rare. Was there some type of preventative testing that could have been done?
Well, that's an interesting question, because the child was born apparently normal and then began this progressive deterioration. The child was eventually on life support, was not conscious, was unable to do anything for himself, and the medical authorities thought that his situation was terminal and that further aggressive medical therapy would not have been in his best interest.
And I think this is, one of those situations where you have a lot of emotions involved.
Yes.
You have parents who are just very hopeful that their child can be cured and that things can help, and there was a lot of legality involved here. Do you think that, in your experience, that this would have helped had he been allowed to come to the U.S. for further treatment or testing? You know,
that's a very good question. We have to look at the big picture ethically here, and normally parental decision-making should be the highest level, but it's not absolute. And parents, they can be wrong, they can be misinformed, but the bar should be very, very high to overturn their wishes. All they wanted was a second opinion, and the medical authorities, for whatever reason, were thinking that was not appropriate. And that's what has left people on this side of the pond a little bit perplexed and often in disagreement.
What do you think, kind of overarching here, what can be learned from Charlie Gard's case for the rest of us watching this? God forbid we should ever be in a situation or know somebody in a situation like this.
Well, the central ethical issue here is a matter of choice. Who makes the call? In a one-payer system like in Britain, that might look a little bit differently in a private payer system such as in the United States. So that's a healthcare debate that goes way beyond this immediate controversy, and that's going to continue for many years to come.
Okay, yeah, so in the end it's basically parents versus these medical professionals and who knows best for their child.
That's right.
All right, thank you so much, Dr. Dennis Sullivan from Cedarville. We appreciate your insight. We'll send it on over to you, Mark.
All right, thank you both.